Let's take a look inside JamVent.
It looks simple, and deliberately so. The designers went back to basics and came up with JamVent, a ventilator that can be built cheaply anywhere in the world, says project lead Dr. Joseph Sherwood.
So by knowing the way that a gas behaves under pressure and how the flow of a gas occurs through a valve, you can actually choose the components of the system such that you can control the pressures and flows exactly as you need to without the need for these complex components.
Those complex parts can cost tens of thousands of dollars. Instead, JamVent uses readily available off-the-shelf components, explains co-designer Dr. Jakob Matizig-Lee, who treats COVID-19 patients.
We're not competing with existing ventilator designs for parts, and also because it's so simple, actually it's very scalable to build and very easy for someone to source these kind of parts kind of anywhere in the world, really.
That includes developing countries with poor health systems. Some African countries have only a handful of ventilators to treat millions of people. The designers plan to seek approval for clinical use next month, including in Britain and the United States. Unlike other recent designs, Sherwood says the JamVent is designed to meet the full demands of intensive care.
So this is not a bridge ventilator, this is a ventilator that performs all of the functions that you need in the ICU to cope with COVID-19 patients and their demanding requirements. The design is actually freely available, and we will work with different manufacturers to go through their own regulatory procedures.
Its potential goes beyond the COVID-19 pandemic, says Dr. Matizig-Lee.
There's no reason that this can't be used to kind of supplement ICU capability around the world going forward for any kind of respiratory condition.
The JamVent design is freely available on the website, and governments and healthcare firms are encouraged to get in touch. Henry Ridgwell for VOA News, London.
An in-breath by the patient.